Hey, what's up, everyone? It's John, and today we're going to talk about, have you ever wondered why we take x-rays when you come to the dentist? Well, here's a tip for you. We don't take x-rays just because we want to bill your insurance. I can promise you that. So there's actually 5 tips and reasons why we take x-rays, and we're going to go over that right now to help you better understand the importance of why we want to take those x-rays when you come to the dentist. So, one, we want to look for decay in between the teeth. Sometimes it is not visible to the naked eye. So, by taking those x rays, those bite wing x rays in particular, we can see cavities forming in between the teeth and hopefully catch them while they're small and not lead to bigger problems down the road. 2, we want to check for bone loss. When we take those x-rays, we can see different degrees of the bone, and ultimately, if you are experiencing bone loss, we can see that on the x-rays. So, periodontal disease, it's one of those painless diseases, and unfortunately, until you start losing teeth, that's typically whenever people realize, hey, my tooth is loose or I've lost a tooth, which that is not normal. So that's what we're trying to see early on detection wise. 3, we want to check for decays under fillings. So by taking x-rays, if you have existing fillings, restorations in there, we can see what's going on underneath. And if you have something that's starting, we can see that on the x-ray. Obviously, if we're looking visually at the top of the tooth and everything looks okay at the top, it's those in between the teeth that the decay can start, and we can't see that with the naked eye. So one thing to keep in mind is if you have crowns, bridges, we can't necessarily see decay under those. So that's typically whenever you take bite wing x-rays. If you do have crown or bridge, it's nice to get a periapical so you can see the apex of the tooth, make sure nothing's going on at the root of the tooth. And speaking of root of the tooth, number 4, we want to look for infection at the root of the tooth. Check out the apex. So that's nice. Every couple years, we want to take x-rays of all the teeth, the roots, and ensure that nothing's going on, because sometimes you can have an infection but not experience pain. And once again, we want to make sure that we head stuff off at the pass and take care of it before it becomes a bigger problem down the road. And 5, we want to examine the area before procedures. Anytime the patient's coming in, it's always good to look at the recent x-rays that were taken as we're getting ready to start procedures. And in some cases, you have to update the x-rays prior to the procedure or during the procedure. So we want to make sure that we have up-to-date information that's accurate to make sure that your procedure goes as smoothly as possible, and make sure that we're giving the correct information for what we're seeing and what we're doing at the time of. So we hope this helps. Of course, as dental professionals, we're always trying to practice ALARA, which means as low as reasonably achievable. So we're not trying to take an excessive amount of x-rays. We just want to ensure that we're taking the correct x-rays so that your appointment can go smoothly and that we're giving you the accurate information when it comes to treatment planning, procedures, etc. So please let us know if you have any questions. And if your office you're going to, if you have questions, ask, hey, why are you taking this x-ray? Don't just automatically assume, hey, I did an x-ray a year ago, I had 2 years ago. It can change very quickly on how frequent updated x-rays need to be taken. So just ask questions, and the dental assistant, hygienist, dentist, that's what they're there for. They'll help you get through that appointment smoothly.